Hello everyone, I'd like to share a personal story with you. About 5 years ago, I experienced a time in which I had an asthma attack every single night for 2 weeks. I was struggling to breathe and confused because I was adherent to my medication. Eventually, I went to the hospital and was given step-up therapy from the corticosteroid I was on at the time. This anti-inflammatory agent failed to control my asthma, and despite getting a higher dose of a stronger steroid, I still had frequent symptoms. I was unsatisfied with the therapy, and this led to the conviction that I would continue my studies in asthma research and potential therapies. Some years later, UBC gave me the opportunity to learn about the pathology of asthma, some of which is shown on the diagram. On the left, we can see a normal unobstructed airway, while on the right, we can see an asthmatic airway that's a lot more swollen, narrow, and filled with mucus, all leading to restricted airflow. Note as well that the innermost lining, the epithelium, is thicker. During my studies, I learned that the epithelium or protective barrier is damaged upon exposure to triggers such as pet dander or dust mites. This is shown at the top right of the diagram. The repair process, however, is dysfunctional in asthmatics, and this leads to the injury being persistent, amplifying inflammation, and increasing epithelial thickening. Currently, there are no drugs to treat epithelial damage. Relying on my personal experience, I searched for studies on a remedy my parents gave to me as a child: honey. I wanted to see if there were studies on the use of honey in asthma, and what a surprise! Two studies found that it was able to reduce epithelial thickening in asthmatic rabbits and mice. It also reduced the buildup of mucus in the airways of asthmatic mice. Yet they did not look at its ability to treat epithelial damage. To test this, I will culture asthmatic epithelial cells and wound them as they would be wounded after exposure to triggers, then treat with honey. I will then measure the rate of wound closure over time as compared to untreated cells. If honey is able to repair the barrier at a faster rate, then I will validate these results in animal models of asthma and ultimately human trials. Should honey be able to restore this protective barrier, it may provide a much needed treatment option for asthma, especially for patients like me who do not respond well to current therapies. It may be that the next time I am exposed to triggers, a little honey might protect me from going to the hospital. Thank you.